Dear friends, patients, and subscribers, let me begin with a question that many of my patients over 50 ask me quietly, almost in a whisper, as if it were a personal failure instead of a medical reality. They say, "Doctor, why is my erection not the same as it used to be?" And the truth is, it's not just you. It's not weakness. It's not lack of masculinity. It's biology, circulation, hormones, nerves, lifestyle, and time. I'm Dr. Rena Loeb, board-certified urologist, and today I want to talk to you honestly, respectfully, and scientifically about why your erection changes after the age of 50. And, more importantly, what you can do about it. First, let me normalize something that society refuses to admit. Every man who lives long enough will notice changes in his sexual performance. Erections that took seconds may now take minutes. They may not stay as firm. The angle may be different. The morning erections may fade. The recovery time between sexual activity may increase. None of this means the end of your sex life. It means your body is aging, and aging bodies require different strategies, not resignation. Let's talk about what is actually happening behind the scenes, not the myths, not the locker room legends, but the real, physiologic truth. An erection is not created by desire alone. It depends on a healthy vascular system bringing blood into the penis, healthy nerves signaling that blood flow, balanced hormones, especially testosterone, and tissue elasticity that allows full expansion. After age 50, all four of those elements begin to shift. The arteries become stiffer due to decades of cholesterol, inflammation, and sometimes smoking or high blood pressure, and the penis is one of the first organs to show the effects of reduced blood flow. Many men don't know this, but an early decline in erectile function can be an early warning sign of cardiovascular disease, often appearing 3 to 5 years before a heart attack. In other words, your penis may be trying to tell you something your heart has not said yet. Meanwhile, testosterone levels slowly decrease at a rate of about 1% per year after age 30, but the effects become most noticeable after 50. Testosterone doesn't only affect libido, it also affects energy, confidence, muscle tone, and the tissue structure inside the penis. When testosterone drops too low, erections become harder to achieve and harder to sustain. Then we have the nervous system. Over time, conditions like diabetes, neuropathy, spine problems, and even long-term alcohol use can damage the nerves that trigger erections. And of course, many men begin taking medications after 50, blood pressure drugs, antidepressants, prostate medications, and others, and many of these impact sexual function in ways doctors rarely mention unless you ask directly. So, when a man tells me, "Doctor, I can still get an erection, just not as strong, or not every time," I don't see a man failing. I see a man whose body is giving important information about circulation, hormones, and metabolic health. Now, let's get even more specific. One of the biggest changes after 50 is the slower filling of the corpora cavernosa, those spongy chambers inside the penis that store blood during an erection. They lose some elasticity, so they don't trap blood as efficiently. That's not psychological. That's structure. Another change is the decline in nitric oxide production. Nitric oxide is the chemical signal that tells the arteries to open and allow blood in. With age and metabolic illness, nitric oxide drops, which means the erection mechanism weakens from the inside out. And then there's the prostate. Even if you never develop prostate cancer, prostate enlargement, called benign prostatic hyperplasia, affects over 60% of men by age 60 and over 80% by age 70. When the prostate enlarges, urinary symptoms appear, but so do sexual changes. The nerves around the prostate are extremely close to the nerves responsible for erections. Irritation, inflammation, or surgery in that area will affect performance. Now that you understand the why, let me shift into the what to do section, because that is where most men feel stuck. The first thing I want you to understand is this: you do not have to accept sexual decline as an irreversible part of aging. You may not be able to turn back to age 25, but you can absolutely improve function, sensitivity, firmness, and confidence if you approach the problem medically, not emotionally. There are 4 levels of intervention. The first is lifestyle correction, and I promise you, this is not generic advice. The penis is a vascular organ. Anything that improves circulation will improve erections. That means reducing visceral fat, improving insulin sensitivity, lowering blood pressure, walking or resistance training at least 4 times per week, and prioritizing sleep. One of the fastest ways to improve erectile function in men over 50 is to reverse metabolic syndrome, and many men do that within months. The second level is medical evaluation. I always test my patients' testosterone, fasting glucose, A1C, cholesterol, and prostate health. You cannot improve what you don't measure. Many men think they have low testosterone, when in fact they have low nitric oxide, or silent vascular disease, or nerve impairment from diabetes. The correct treatment depends on the correct diagnosis. If testosterone is truly low and symptoms are significant, hormone replacement therapy may be considered, as long as it is medically supervised, with proper monitoring, and not used recreationally. Testosterone alone will not solve erectile dysfunction, but it will support libido, energy, and tissue responsiveness when combined with other strategies. The third level involves medications that enhance blood flow. And here is where I will mention the compounds, not the brand names. Sildenafil, tadalafil, vardenafil, and avanafil are called PDE5 inhibitors. They work by increasing nitric oxide availability in the penis and relaxing the smooth muscle inside the erectile tissue, allowing more blood to enter and stay. These medications do not create desire, but they enhance the physical response to desire. They also work better when testosterone levels are not extremely low, which is why evaluation matters. Some men say, "Doctor, I tried sildenafil once and it didn't work." And I always respond, it often takes proper dosing, correct timing, and repeat use. It is not a magic button. It is a vascular support tool. And yes, there are differences. Tadalafil lasts longer, sildenafil acts faster, and so on, but the goal is the same: improve blood flow, not replace natural function. The fourth level is advanced therapy, reserved for men who do not respond to medication. Options include vacuum erection devices, penile injections that use prostaglandin compounds, shockwave therapy to stimulate blood vessel growth, and, in severe cases, surgical implants. These sound intimidating, but thousands of men over 60 regain full sexual function through them. Now let me address a sensitive but common misconception. Many men believe erectile dysfunction is purely psychological. While anxiety and performance pressure can absolutely worsen the issue, the root cause in men over 50 is physical more than 80% of the time. And the longer a man pretends it's just in his head, the more time he loses, time that could be spent improving circulation, hormones, and nerve health. Another myth: if I still get morning erections, I don't have a problem. Morning erections can persist even when sexual erections decline because the brain triggers them differently during REM sleep. It's not a reliable indicator of full function. And the final myth: using medication means I've failed. No, gentlemen. Using medication means you are alive in the 21st century with access to tools your father and grandfather never had. So, what do I recommend you do next? Number 1, stop guessing. Get your blood work done. Check your testosterone, glucose, and lipids. Ask your urologist or primary doctor whether your current medications may be interfering with erections. Start walking if you haven't walked in years. Reduce sugar and refined carbs. They damage nitric oxide production more than most men realize. If you are ready for medical treatment, do it under supervision. Sildenafil, tadalafil, and similar compounds should not be taken from unknown sources. They must be dosed properly and safely, especially if you take nitrates for heart disease, because mixing them can dangerously lower blood pressure. And if you're listening to this and thinking, "Doctor, I'm embarrassed to bring this up," let me remind you, I am a urologist. I treat this every single day. I would rather have 10 men ask too early than 1 man ask too late after vascular damage becomes irreversible. Before I close, let me say this clearly. Intimacy is not just physical. It is confidence, connection, and self-worth. When a man believes he has lost his sexual ability, he often withdraws emotionally, avoids touch, and assumes rejection before it happens. That is unnecessary. There are solutions. There are treatments. There are options at every age. I have men in their 70s who returned to an active sexual life. Not because they were lucky, but because they took action. So, gentlemen, if your erection is not the same as it once was, don't accept it as the end of your story. See it as a health message from your body. Respond to it with science, not shame. And now, I want to hear from you. If you found this helpful, subscribe to this channel so I can continue guiding you through the real, unfiltered truths of men's health. Leave a comment below. Let me know your age range, your questions, or the topic you want me to cover next. I read your comments, and many of my videos come directly from what you ask. You don't have to face this alone. The information is here. The treatments exist. The first step is simply acknowledging the change and choosing not to ignore it. Thank you for watching. Take care of your health, and I'll see you in the next video.